The facts are not in dispute. Cities across the country are reporting jumps in 911 calls for suicide attempts. The National Distress Hotline is getting 900% more calls compared to this time last year. The only discussion is about how we respond. Kelly Posner Gerstenhaber is the founder and director of the Columbia Lighthouse Project. I rely on her often for perspective on how we deal with mental health in moments of crisis. We've never seen anything like this, Doc. What should we be doing right now?
Well, we need to put this in the perspective that it deserves. So 900% increase. What does that tell us? People are suffering, right? They're suffering a lot. But let's understand what we know. We know the good news, Chris. I'm always starting with the good news. Suicide is preventable. This is not an inevitable outcome. Mental health issues like depression and anxiety are treatable. So what have we learned? What do we know about how to do that? Okay, let's remember in terms of the magnitude where we started, what our baseline was before this pandemic, right? Suicide takes more firemen than fire, more police than crime, more soldiers than combat, more lives than car accidents. Depression, its biggest cause, is the #1 cause of global disability. But again, the good news is we know how to treat. But this pandemic brings with it a tsunami of risk factors, the perfect storm. We know that with economic downturns in the past, they track in rate and pace with the suicide rate. We know that isolation and loneliness is a huge risk factor. Did you know that the CDC tells us that one of the most important things we can do to prevent suicide is connectedness, right? And so it's such a critical thing to remember now. What we have to understand is that social distancing and quarantine does not inevitably mean social isolation. So what do we need to do? We need to connect. And what we know in terms of mental health issues being treatable, telepsychiatry and telehealth is incredibly effective, but you might only get that once a week. So what does that mean? It means we have to rely much more on peer-to-peer, peers helping each other. We've learned that from other wartime scenarios we've been in, from other mass traumas, that peer-to-peer help and connection is one of the most important things you can do. So right now, we need to reach out. We need to be here for each other. And what does that mean, reaching out, okay? People suffer in silence. The 900% increase that are calling the crisis lines have a will to do that, but very often people won't. We knew before this, Chris, that we had to find people where they live because they often don't have the will to come to you. So we need to ask routinely. We need to ask our friends, check in with our neighbors about, and be direct. How are you doing? Ask specific questions about whether they're feeling suicidal, right? That's what we know. And let me just give you the perspective, lest anyone doubt the impact of connecting. Do you know there was a study that showed the opposite, that loneliness is equivalent to smoking 15 cigarettes a day? It can be more lethal than heart disease and obesity, right? So this is the good news. We can connect. We can connect people to the care they need. And by the way, you know what we've learned from other mass traumas? That's not only going to help them, it's going to help you as well. We know that in these desperate times, what we can do to help ourselves is find meaning and purpose in our lives and help.
Where do we go to
friends
find out how do we learn how to do that? Tell people where to go, because you've already set out the right questions to ask and a series of if-thens. Ask this question, if they say this, go to this. Where do people go to get the ways to help connect?
Yes, so you can go to, it's called the Columbia Protocol, and it's cssrs.columbia.edu, and it gives you very simple questions that anybody can ask and gives you the next steps You know, in the past, people didn't know what to ask, they didn't know what to do with the answers, and they didn't even know if it was going to be harmful to ask somebody. It's actually the opposite. When people are suffering, they want help, and they feel a relief and distress when you actually do ask.
Now, Kelly Posner Gerstenhaber happens to be a very close friend of mine and the missus. And one of the things I love about her is that not only is she a psychiatrist par excellence who got the highest civilian honor for her work in this area, but she can interview herself. And that's why we can make so much out of so little time, because she knows the right questions and the answers. Thank you for walking us through this and doing so quickly. I will put out on social media how to get to the website for the Columbia Protocol. And it's only referred to that now because I kept mangling the name of the Lighthouse Project. So now she just went with that because I kept getting it wrong on television. Kelly, thank you very much for helping us understand how to deal with such an obvious and severe need. We've ignored it for too long. We can change it ourselves. Thank you.
Very grateful, Chris, to be here.